Kim, tell us what's on your radar today.
Well, on Tuesday, Jonathan Newman, the CEO of Sweet Green, went to LinkedIn and peddled right-wing narratives about being healthy while fat-shaming people into eating at his expensive salad restaurant chain. Well, at least that's what the social media outrage machine would like you to think. People are livid because in his post, Newman pointed to a stat released by the CDC that people living with obesity account for 78% of the COVID hospitalizations. Newman, who is fully vaccinated and has implemented mask mandates at his restaurants, was calling attention to one glaring fact about the COVID-19 pandemic, that we haven't been focusing on health at all. Newman pointed to the extreme measures we've been willing to go to in order to avoid illness and death and questioned why we haven't been willing to go to the same extreme measures to be healthy. And for this, Newman has received a flurry of social media pushback and has been accused of being fat-phobic and spreading disinformation. He has since removed the post. Now, there is no doubt weight is a sensitive topic. 3/4 of all Americans struggle with weight gain, and nearly half struggle with it on a severe level. Our society has been outright mean and alienating to people who struggle with extra pounds, and the disease is often misunderstood as simply being about people making bad personal choices. And the reality is much more complicated than that. Hormones, addiction to sugars, and an overly medicated society has caused the obesity epidemic to skyrocket over the past few decades. People in their desperation to lose weight often end up turning to fad diets and promises of magic weight loss remedies that end up just making things worse. And in the end, many people just give up and allow the weight to keep piling on. And the pandemic only made things worse. A Harris poll found that of the people who gained weight during the pandemic, the average amount was 29 pounds. So if you weren't overweight before COVID, you probably were after. Kids gained weight too. According to the Journal of American Medical Association, kids, especially those ages 5 through 11, gained a significant amount of weight during the pandemic, increasing the already alarming levels of obesity in children. So we all have to lose weight. Okay, fair enough. But besides the pandemic causing us to eat our feelings by snacking endlessly, what does it have to do with COVID? Well, going back to that CDC stat Newman pointed out, people living with excess weight accounted for 78% of the hospitalizations. The agency says obesity may triple the risk of severe COVID. There are other comorbidities that can cause severe outcomes. Of course, old age is one of them, and there isn't anything any of us can do about that. But minus the elderly, as well as those who are battling other things such as cancer, the other main risk factors include hypertension, diabetes, hyperlipidemia, and coronary artery disease. And all of those comorbidities are related to excess weight. Now, obesity is a global problem. So is COVID. Take a look at these maps. One shows the percentage of obesity around the world. The darker color, the more prevalent obesity is within the population. The other map shows COVID deaths per million, and you can see they look fairly similar. Asia and Africa have very low rates of obesity within their societies, and they've had the best outcomes during this pandemic. And many Asian countries have been slow to vaccinate. In Africa, vaccination has been nearly non-existent, yet they have fared much better than we have. So it really shouldn't be a left-right issue to discuss health and how we can have better outcomes without relying so heavily on medications and drugs. Asian cultures regularly use natural remedies to treat illnesses and disease within their state-of-the-art medical facilities, including during this pandemic. Doctors in China have been using a combination of modern and traditional medicine while treating COVID patients in hospitals. Many countries in Asia either make mandatory or heavily encourage exercise for its populations. Of course, weight loss is slow, and just telling people to lose weight is not going to end this pandemic. We are in a situation where we have to rely on modern medicines to help supplement what our bodies can't do because we've spent decades destroying our health as a society. The Chinese and Japanese can promote a combo approach because, quite honestly, their populations aren't as unhealthy as we are. We are at a point where we need serious intervention, but we should strive to move away from this necessity so that the next time a global pandemic hits us, we have better outcomes. The vaccines are helping people stay out of the hospitals, this is true, but so is just being healthy, and that's a fact. So the CEO of Sweet Green is right. Despite the optics of him promoting food choices that clearly benefit his bottom line, we should be looking to eat healthy and working out to boost our immune systems. The reality of who is impacted most by this current virus should be blasted on the news so people have a clear understanding of the danger for them personally, rather than it just seeming like everyone is the same. Maybe then people wouldn't be so hesitant to make choices such as take the vaccine or start losing weight in order to mitigate their own personal risk levels. So I'll end with this. Even with the vaccines, the masks, the lockdowns, your personal chance at a better outcome against COVID is much greater if you're healthy. It shouldn't be an either or. So, Ryan, I'm going to ask you about this because this CEO was heavily criticized on social media, being called fatphobic. I mean, what is it, do you think, that has created this environment where the discussion about being healthy and exercising, eating right, losing weight has become a left-right issue?
Is it a left-right issue? I mean, I think there's an American tendency that is present in our culture now that goes back to the generation where everybody got a trophy for participating in the soccer, in a soccer game, that everything that you do is special. And any criticism of that is then a criticism of you as a person. There was an article in the New Yorker recently about Costa Rica's medical system that was just kind of painful to read as an American, because starting in the 1970s or so, and I recommend it to everybody, they combined their public health and their medical systems together into one. We don't do that. Public health is a little side thing that that Dr. Fauci's involved with, and nobody had heard of it before this pandemic even came around. And what they did is they said, let's go door to door throughout the entire country and find out what the health problems are of the community, and which ones can be tackled with the fastest, cheapest, and most effective interventions. And as a result, they've been able to decouple health from wealth. Around the rest of the world, your health basically is connected to how wealthy of a country you are. Costa Rica figured out a way to do it that says, no, actually, this person needs iron pills, and we don't need to wait until our GDP triples to get iron pills to her. And when you look at it holistically like that, you start to see what the obvious problems are with the public health of your society, and then you can start to design interventions around that. But we refuse to even look at it. Our system is, if you get too sick, then you show up at the doctor, and the doctor says to you, what's bothering you? What's your biggest problem? What's your symptom that I can deal with today, and then send you back into this toxic society.
Well, and I think that a conversation around preventative care is really important coming out of COVID, to think about what kind of health steps we can all take as individuals to make ourselves better positioned to withstand viruses like this. But one important point, and this goes to Ryan's point, is when I was working the previous administration on the issue of COVID, one thing that we found is disadvantaged, underprivileged communities were at times most predisposed to COVID, and it's because they do have higher rates of some of these comorbidities, and it's directly tied to income and wealth disparities. So if you're living somewhere that's a food desert and you don't have access to, fresh organic food, the likelihood of having diabetes, of being overweight, of being obese, or hypertension are far higher. So those communities ended up being disproportionately impacted. So I completely agree that there's got to be an overarching approach to how we look at both public health and then our medical care. The other point I would make is I think our society and our culture is, body positivity is a very good and important thing. And we need to inspire women especially, because I think we put so much pressure on ourselves to just feel good about who they are. But we also need to acknowledge there's an obesity crisis in this country, and that it comes with so many risks associated with it. And I think we need to be more honest about what's healthy and what's not in terms of weight and in terms of addressing those issues.
Right. I do think we need to separate there has been a culture to fat shame or to make people feel like they're unattractive because of their bodies. And I do think we need to separate that from the health aspects and saying, look, weight loss is not about, because we want you to be attractive. It's because we want you to be healthy. And there's a difference there.
Definitely.
And so I think decoupling that would be really important for sure. So, all right, we do have more Rising coming up next.